Hello, my name is Julie Matheny. I am a speech pathologist and international board certified lactation consultant, commonly called an IBCLC. Welcome to Breastfeeding Basics. Today we are going to cover and discuss all the essentials that you need to know about breastfeeding. Here is my class disclaimer. I am teaching you about feeding. How you eat is different than how I eat. How your baby feeds is different than how someone else's baby will feed. We will talk a lot about theory and practice, but your feeding journey for your baby will look different than everyone else's baby. Another reminder is that comparison is the greatest way to have your joy and peace stolen from you. What you see on social media or from someone else will look different than what your feeding journey will look like. And that's okay. There are different ways to feed a baby, and hopefully you will find some support in this class. During this brief time together, you will learn about breast anatomy and the physiology of making milk and how milk changes over time, things you can eat and drink while breastfeeding, and the impact of medications and periods on your milk. We will talk about hand expression of colostrum, which can be done while pregnant or in the early days after delivery. Another focus will be on position and latch of your baby at the breast. I will also briefly discuss pumps and pump flange sizing at the end of this class. Let's jump right in. The breast is a glandular organ that has milk-making lobes that interact with your bloodstream. Milk is made in these lobes and funneled down through collapsible milk ducts to pores at the end of your nipple. You could have anywhere from 4 to 18 nipple pores where your milk can come out to your baby or a pump. Milk that does not come out of your nipple can be absorbed in your body through your lymph system. Nipples come in many shapes and sizes. The size, shape, and length do not determine how well your baby feeds. We call it breastfeeding and not nipple feeding. But do be aware of what your nipple looks like during pregnancy. Interventions during labor and delivery, such as having a lot of IV fluids, may make your nipples look flat or inverted. It may look like this for a few days or even weeks after delivery. This may make latching more challenging at the beginning. The size of your breast also does not indicate your milk production. Very small breasts can make just as much milk as very large breasts. Everybody's body has a different capacity to make different volumes of milk. We call this breast storage capacity. It is not determined by the size of your breast, but by how much milk-making tissue is inside of it. Those with a large storage capacity can hold more milk at any given time, and baby may take large volumes less often. Those parents can go longer between feeding or pump sessions without feeling uncomfortable. With a smaller storage capacity, You can hold and make less milk in the breast at any given time. Babies have less milk available, so they feed smaller volumes more often. These parents may experience discomfort if they go too long between feeding, or see a drop in supply if they don't feed or pump enough. Typically, as long as the breasts are emptied frequently, both types of storage capacity will make plenty of milk to feed your baby. The more milk you move from the breast, the more milk your body will make. Your body wants to feed however many babies were born. A body that consistently moves milk will continue to make more milk. A full milk supply is the ability to make 24 to 30 ounces of milk in a 24-hour period of time. Your body does want to figure out how many babies were born and how much milk that baby is taking. Milk that sits too long in the breast can cause inflammation in the breast, which we would call a plug duct or mastitis. That's inflammation. Expect your milk volumes to change throughout the day. Most people find they have the highest volume of milk first thing in the morning and smaller volumes of milk later in the evening. This helps to hydrate your baby in the morning and eventually help them not poop overnight. The longer you go between feedings, typically the higher water content or volume in your milk. The shorter you go between feedings, the higher the fat content and smaller the volume. All milk is good milk, and your body is trying to give your baby exactly what it needs. What you eat can change the flavor of your milk, but not the nutrient content. Nutrient content is based on the age of your baby and how far away from pregnancy you are, how often you're moving your milk as well. Milk can range in color from blue to white to yellow, orange, and even green. This is usually from what you are eating or drinking. Pink milk usually means you have a little blood in your milk and you want to explore why so you can fix it. Each breast can work independently as well as together. It is possible to successfully breastfeed on only one side. People tend to make more milk on the right side or the right breast, but you can also make more on the left. Each breast also has its own flow rate, volume of milk it produces, and flavor of milk even in the same feeding. How do you know your body will make enough milk for your baby? Good indications are a change in breast size and areola color during pregnancy, as well as little bumps around the areola that are called Montgomery glands. Less than 10% of pregnant people who give birth will not make enough milk for their babies. There is always a reason why. Common reasons can include breast tissue that never developed during puberty, a thyroid or hormone disorder that is uncontrolled, undiagnosed, or unmedicated, or a history of some kind of difficulty getting or staying pregnant. There may be a history of some kind of breast trauma or surgery, or the breast was not stimulated well enough in the early days after birth. Let's talk about milk. Colostrum is milk. It is your first milk that has been produced in the breast since 10 to 14 weeks gestation, and ready for whenever your baby is born. Some may naturally see it leak around 34 to 38 weeks. It is also normal not to see it at all. It is a thick, sticky, syrupy first milk that is the perfect nutrient balance for a newborn. It is a high-protein laxative milk that helps baby take their first poops. Birth of the placenta triggers oxytocin and prolactin to increase and release colostrum to be removed by your baby. As long as you have a placenta intact, you will have colostrum. Once the placenta is fully birthed from your body, your milk will take several days to transition this colostrum to mature milk. One important skill is hand expression. Because colostrum is thick and sticky, it can take a little time and use of the hands to move this milk, which can be more effective than a breast pump. To hand express, start by giving your breast a gentle shake and a massage. Gently massage the breast for a few minutes. That's because this thick milk needs encouraged to move down your milk ducts. Then take your hand in either a C or a U shape. Place your finger and thumb where the areola meets the breast and apply gentle pressure through your areola behind the nipple. You want to make sure your finger and thumb meet behind your nipple symmetrically to encourage milk to come out of your nipple. Don't get too close to the nipple. You won't see your milk move that way. You want to make sure to do symmetrical movements behind that nipple. It may take several minutes of gentle massage and compression before you see your colostrum. Your colostrum may appear clear and shiny or thick and creamy. Don't be alarmed if you don't see any your first try or if you never see more than small amounts. It is generally considered safe to start harvesting your colostrum to store in a syringe in the freezer prior to your baby's delivery, starting around 36 to 37 weeks if you have a low-risk pregnancy. Consider speaking with your birth practitioner regarding collection of colostrum prior to birth.
So what we're gonna have Mama do is Mama's gonna do massage first. So she's gonna start at the back of the breast and massage down towards the nipple. And the breast is a circle, so she can work anywhere around that circle to try to bring that milk down. Now this Mama is actually still pregnant, and we're working on hand expressing colostrum. Okay, perfect. And then once you've done some of that massage, again, you want to keep your fingers on the breast and not on the areola. And you want to come back and squeeze. Back and squeeze, perfect. This finger, now from my angle, I can see it. Yep, you want to be just a little bit lower. There you go, perfect. That's perfect. You're gonna just keep squeezing, and you can rotate your hand anywhere around that circle because the breast is a circle. And so sometimes by just repositioning your hands, it activates different milk ducts. That's perfect. And we don't have a video of the other side, but it took us quite a few squeezes to start to see the milk. But then once we started to see it, we could really see it come pretty quick. Now, this is the left breast. 70% of women make more on the right, 30% make more on the left. But most women will have a harder time in the first few days hand expressing from the left, just because it doesn't tend to make as much. But look at that, you can actually start to see, there's the milk. There it's coming. So it's gonna start when before you have a baby, Or when you're just first starting, this is about how long it's gonna take to hand express before you see anything. And you'll just see these nice clear dots at the tip of the nipple. But the more you express and the more you move your hands, the more and the faster you'll see that come. And I like how you're using this other hand. You can also give a little pressure from that hand to be able to bring that milk out too. Beautiful. And then we'll just use our cup and we'll do a little scoop. Oh, let's find her. And drop. And we can collect it. Perfect.
Colostrum is in small amounts as your baby has a small stomach. All of our stomachs are the size of our fist, but they expand to hold what we eat. Babies are born constipated and fluid overloaded with a fasted stomach. It takes about 3 days for the stomach to stretch and hold larger volumes. It takes about 3 days for babies to poop out their meconium, their first poop, which is thick, tarry, and black. It also takes about 3 days for colostrum to transition to mature milk. Because of this, it is normal for babies to lose 7 to 8% of their birth weight in the first 3 days during this process. They will start to regain their birth weight as milk transitions from colostrum to mature milk and increases in volume. After birth, your baby will go through stereotypical patterns to initiate their first latch. When at all possible, ask your healthcare provider to promote this first latch. This is called the golden hour. It usually takes babies an average of 1 hour for their first latch. Babies are often very sleepy on the first and second day after delivery. Labor and birth are as hard on them as they are on you. Be prepared for them to sleep most of the day and then party all night to make up for those feedings. Babies need approximately 22 to 24 good feedings to help transition colostrum to mature milk. This often occurs on the second night. Be prepared for your baby to want to feed all night the second night. You can always use hand expression the first and second day to keep your colostrum moving and to have on hand to feed back to your baby. If your baby is not feeding well in those first 48 hours, it is essential to start hand expressing, then pumping to bring in a full milk supply. You can continue to work on latching baby while increasing your milk to a pump. Make sure to reach out to a lactation consultant at that point for help. On the third or fourth day after birth, as breasts are stimulated and milk moved, your milk will increase in volume and transition to thinner, faster flowing milk. It may look white, yellow, or creamy orange. During this time, your breasts will fill and engorge. They may feel lumpy and hot. Frequent feeding the baby, doing gentle massage, warm showers, and hand expression can help with this process that usually lasts 24 to 48 hours. During this time, watch the baby and not the clock. Feed your baby whenever baby is showing signs of hunger, which may be every 1, 2, or 3 hours. Feeding every 3 hours or 8 times a day is the minimum that baby should be fed while a newborn and learning how to feed. You should be waking your baby up at least every 3 hours to feed until they have regained their birth weight and are feeding well. It is absolutely okay to feed your baby more frequently than that. Many will feed 10, 12, or even 16 times a day. So if baby is feeding frequently, that's okay. The time is measured from the start of the last feeding. So if your baby started feeding at 9 a.m., they should be fed by no later than 12 p.m. noon. Most babies want to feed frequently, every 1, 2, or 3 hours. Watch your baby, not the clock. Things that can delay your milk from transitioning from colostrum to mature milk can include excessive fluids during labor and delivery, long labors that last more than 24 hours with extended pushing stages, a baby that is sleeping or not feeding enough, or a baby with a tongue tie. Your milk is made from your blood, so a retained placenta, or if you had a large hemorrhage or blood loss during birth, can also delay your milk from increasing in volume until your body recovers. During the first few months of lactation, you may notice your breasts feel full between feedings and then soften when you pump or breastfeed. This full, soft lasts for just a few weeks. Do not be surprised if you don't feel that feeling for long. Your breasts will go back to pre-pregnancy size and feel soft between feedings. That is a good sign that your body is more efficient at making milk. In the early weeks to months after delivery, your body knows it had a baby and wants to feed it. Your body is being driven by hormones from pregnancy and should be making extra milk, or more than the baby would typically take during a feeding. It knows your baby will cluster feed during growth spurts, and you need lots of available milk all the time. Around 3 to 4 months, your body knows it no longer has a newborn, and your milk moves from being hormone driven to just making what the baby or pump is moving routinely. Continue to watch the baby and not the clock. Feed the baby whenever the baby is hungry. Pump whenever baby is getting a bottle. Remember, babies want the breast for more than just nutrition and hydration. It is also for comfort, sleep, and pain relief. We determine how much milk baby needs by their weight for the first few months. Babies need teaspoons of milk per feeding for the first few days, up to an ounce on the third day, about 2 ounces for the first 2 weeks per feeding, and then between 2 to 5 ounces from 1 month on. Here is a chart that shows how much baby needs by weight. Once babies reach about 10 pounds, you no longer need to base their volumes by weight. Once your baby reaches that weight, usually around 3 to 4 months, your baby will need 25 to 30 ounces of breast milk in 24 hours. How much your baby gets at each feeding is determined by how many feedings baby takes. For example, if your baby feeds 10 times in 24 hours, baby would need about 2.5 to 3 ounces per feeding. Your body does not need to be making gallons of milk a day. That is very good news. when you are breastfeeding, you can eat whatever you want in whatever quantity you want. We typically say you need an extra 300 to 500 calories above your normal intake because you are making nutrition for two. Culture may dictate what you can and cannot eat, but science does not. If your baby is sensitive to something, it will be unique to your baby. It is important to hydrate well when breastfeeding. The general rule is eat to hunger and drink to thirst. There is no bar, tea, or cookie that is marketed today to make breast milk that can replace frequently feeding or pumping milk from the breast. That is always the best way to make milk. Caffeine is considered safe to drink while breastfeeding, up to 300 milligrams per day. Caffeine appears in your milk within 15 minutes and reaches a peak level about 1 to 2 hours after ingestion. It should be cleared from your milk in approximately 4 to 7 hours. If you drank coffee during pregnancy, your baby is already used to caffeine. If you are going to start drinking after delivery, just start with a small cup in the morning. Alcohol is also considered safe to drink while breastfeeding, when done in moderation. This means one standard drink, one beer, one glass of wine, or one standard liqueur. Alcohol reaches a peak in your bloodstream about 30 to 60 minutes after drinking and clears from your body and your milk within 2 to 3 hours per drink. Make sure you're eating food and drinking water when drinking alcohol. Alcohol does not accumulate in your milk, but clears your milk at the same rate it clears your blood. Only about 2 to 6% of the alcohol you drink will actually reach your milk. If you have only had one standard drink, there is no need to pump and dump your milk. Go ahead and breastfeed. But you should never bed share with your baby if you're drinking any alcohol. Most medications are considered safe while breastfeeding. Antidepressants, antibiotics, and pain relievers are typically considered safe. While most medications are safe for you and baby, they may cause side effects. For baby, they may change their poop. For mom or parent, they may change your milk supply. Antihistamines like Benadryl or Sudafed are known to decrease milk supply. Some antidepressants like Zoloft may actually increase milk supply. If a physician tells you to wean because of a medication or procedure, please check with an IBCLC, as most medications are compatible with breastfeeding with no need to pump and dump. Breastfeeding can delay the onset of your period from coming back, from weeks to months to when you wean. The single most important factor for suppressing ovulation and your periods is strong, frequent sucking at the breast. Most find their periods return when their baby sleeps longer overnight or starts eating solid foods. Your milk changes flavor and may decrease during your periods. Some find baby gets fussy just before their period starts. If you do get pregnant again while breastfeeding, your hormones will shift to support your pregnancy, and milk supply will return to colostrum and drop in volume at the end of your first trimester. Older infants and toddlers may nurse through this, but young infants may struggle to get enough milk from the breast and will most likely need to be supplemented. Birth control also impacts milk supply. Anything with a hormone has the potential to decrease your milk supply. Birth control with no hormone should not impact supply, but a hormone-based IUD or the mini pill has a risk of decreasing supply. If you normally use a hormone-based IUD, consider a round or two of the mini pill first. If you see a supply drop, you can stop taking the pill. Let's talk about feeding cues, position, and latch. Typically, babies will go through a series of behaviors to let you know they are hungry. It will often be 1, 2, or 3 hours since their last feeding. They will start to lick or smack their lips and suck on their hand, rooting and looking for a breast. It's time to feed. If they are crying, that is a late hunger cue. If you just fed them and put them down and they start crying, it doesn't mean necessarily that they're hungry. It just means they did not want to be put down. Every baby is unique in how they feed. Some will feed in a few minutes, while others may feed for longer, a half an hour or even more. Some babies feed every hour or 2 hours, while others can go longer, 4 or 5 hours. This can be dependent on your milk production and storage capacity, as well as how full they like their tummy. In general, find your baby's preference. As long as you have a pain-free latch where you are feeling your baby swallow and feeling like milk is moving, where your baby is making lots of wet and dirty diapers or pooping routinely and gaining weight over time, let your baby feed as long and often as your baby wants. How do you know your baby is swallowing? Most people are told to listen to their baby swallow as it makes a soft puff of air. You can watch and feel for the swallow. Baby's cheek should stay round without a dimple. Their jaw will move in small movements when they suck, with a drop or longer movement when they swallow. You may also feel this jaw drop by touching their cheek or underneath their chin on the base of their tongue. Here is a video of what efficient baby feeding at the breast looks like.
Always like looking for textbook.
There are many positions that you can breastfeed your baby in. You can breastfeed sitting up or laying down, being on your side, on your back, standing, and walking around. Your position doesn't matter. Latching your baby looks similar in all positions. We want your baby touching your body, belly to belly, so that their belly button touches your body. We want their arms to hug the breast. We want to tuck them back in the opposite direction of the breast you are latching in. We want their arms to hug. Baby's chin should touch the breast first. And you want to aim your nipple to their upper lip. Baby's ear, shoulder, and hip should be in a straight line. I will demonstrate this with a few positions, and we will also see a few latching videos. The breast is a circle. Your baby can latch anywhere around that circle, but their orientation to your body is the same. You want their face coming straight to the breast and not twisted or turned towards one shoulder. We want that chin coming to the breast first to help promote a deeper latch. Your latch should feel comfortable with no pinching or stabbing pain. A tug or pull is normal. Initial discomfort that lasts less than a minute and nipple tenderness for the first 5 days is still considered normal. If you've never breastfed before, it may feel different, but your nipple should go in and out the same shape. If you have cracked, bleeding nipples or intense pain, if your nipple comes out of baby's mouth looking pinched, creased, or the shape of a new lipstick tube, work with a lactation consultant to figure out why. If you do need a pump, having a quality pump is very important. You want a pump. Ooh, there was a spider. If you do need a pump, having a quality pump is very important. Pumps like the Spectra S1 or S2, the Unimom Opera Plus, Limerick Joy, Medela Symphony, Hygeia Enjoy, or Pumpables Genie Advanced are good primary pumps. Having the correct flange size is also very important. You can get an estimate for your size by taking your bra down, roll your nipple between your finger and thumb so that it comes out slightly. You can then measure with either a ruler, a printable ruler, or a nipple measuring tool to the base of your nipple. This is an approximate measurement. You may need to size up a few millimeters from this. Most people cannot pump with the flange that comes in the box. There are lots of different pump flanges on the market. I typically put people in flange inserts or soft silicone flanges because size does matter. When you turn on your pump, there will be 2 basic modes. A quick stimulation that is fast with light suction, and a slower expression mode that has stronger suction. You want to start with the quick stimulation until you see milk flow, 1 to 2 minutes. Then switch to your expression mode for 4 to 6 minutes. This helps pump your milk. When you see milk flow start to slow, go back to the stimulation mode. You can alternate stimulate, express, stimulate, express for several times during a 15 to 20-minute pump session. Pumping should also feel comfortable. If pumping is not comfortable or you're not seeing the milk supply you expect, reach out to an IBCLC lactation consultant. If you have a sleepy baby or a drowsy baby that's not latching well, if you have a non-latching or painful latch, if you have nipple damage or pain, or if pumping is not going well, if your breasts are engorged, baby is losing weight, or not gaining weight as quickly, please work with a local lactation consultant to continue to help you on your journey. Congratulations on your new feeding journey and your new baby. Don't hesitate to reach out by email to lalactation@gmail.com or follow me on Instagram at lalactation or lalactation on YouTube. Now you know.